Right, let me hit record and welcome everybody. This is Dr. Staci Holweger, who is a doctor of integrative medicine, and she's here to talk about stem cell patches. I put mine on right there. This is my second day, so I'm really excited about what this is doing for people, because this is not just, slap a patch on or, take some medicine, this, that, and the other. This is activating our own body's regenerative system, right? Can you hear me?
I can hear you. Yes.
Oh, okay. Yeah, I was asking you.
Oh, I didn't hear a question. I thought you were just speaking to them.
Yeah. So yeah, and so if you wouldn't mind, Staci, talking a little bit about how does this little, it looks like a Band-Aid, and like I cut myself while I was shaving and and I put a Band-Aid on, but it's not, and there's no medicine or anything in there.
Yeah, okay, sure, absolutely. I'm more than happy to. So I'm sure many of you have heard of stem cells. You're very familiar with the healing properties that stem cells have. We are born with a plethora of stem cells, millions and millions of them, which is why children have the ability to have boundless amounts of energy. They sleep like babies. They can fall out of trees and fall off their bikes and jump up, and they have no problems whatsoever recovering or healing from breaks and falls. They, of course, are sharp as tacks, right? They're never missing a beat on anything. And they go. That's because they have plenty of stem cells on board. Well, when we age, we produce less and less stem cells. So by the time we're in our 30s, we're making about half. By the time we're in our 60s, we're making about 10% of those stem cells that we did when we were young. And so this patch, this little round Band-Aid, as you mentioned, this patch is a non-transdermal patch. And what that means is it's not actually putting anything into the body. So you're probably familiar with pain patches or birth control or estrogen or nicotine patches, that when you apply it to the skin, because the skin is the largest organ, something is going into the skin and affecting the body on the inside, right? Instead of a medication. That's a transdermal patch. This is non-transdermal, which means it's not actually putting anything into the body. This is called photobiomodulation or phototherapy, light therapy. And what that means is our inventor, scientist, researcher, and owner of our company, David Schmidt, has figured out a way to use this little round Band-Aid, like you mentioned, as a means for signaling the body to increase its own stem cell production. So you can see it's sticky, right? It's sticky. It's a 3M hypoallergenic sticky adhesive, okay? The center is sticky. So this is not a Band-Aid where there's something in the middle of it that's going into your body. What this is David has figured out the right combination of, over the course of 10 years, of organic amino acids and salts and water to form a crystal lattice on the inside of this. And so when you apply it to your skin, because we emit a low level infrared light, and we know that because if we were outside right now, behind me, it's dark. And when you go outside, you can't see a person unless you're looking through night vision goggles. And then you can see the low level infrared light being emitted, the heat being emitted from the body, right? So when we apply this patch to the skin, our body's low level infrared light reflects back a signal. And that signal increases our own stem cell production. So we have stem cells, and like I said, as we age, we make less and less. So this is asking our body to make stem cells again, like it did when it was younger. Now, knowing that stem cells are the holy grail of healing, they are regenerative, they repair, they rejuvenate, regenerate all areas of the body, all tissues, cells, and organs, and whatever the body needs first. The body is always seeking homeostasis, that balance. We know that balance gets out of whack from diet, lifestyle, injury, stress, illness, surgeries, accidents, you put all that together, that's a human being, right? And
Yeah.
so there's a lot going on the inside, and that we don't have the capabilities anymore to help ourselves heal. So we try to take medications or supplements or other therapies and things like that we're trying to do to help ourselves have the best quality of life, to feel good on a daily basis. And so what this patch does, signaling your body to make more of its own pluripotent stem cells. Pluripotent means that they can turn into any type of cell, tissue, or organ needed. So your body's making more of its own. Those stem cells go to work to start to heal, repair, regenerate, and rejuvenate the cells, the tissues, and the organs, literally reversing the age of those, improving the functionality as if they were younger. And we know this from clinical studies. David, like I said, has taken 10 years to invent this patch. During the course of that 10 years, he has compiled over 80 double-blind placebo clinical studies done with real people in real laboratories, real physicians, doctors, universities all over the country and all over the world. And so this patch actually has a 20-year patent. That's pretty impressive. That means there's nothing else like this on the planet. Okay. And so that 20-year patent is just one of the patents that David has. He has over 130 patents in the area of regenerative medicine. So what that means is the science is here. You know, as a doctor, I need the research, I need the proof, I need the data. But I also want to know what's happening to the people. I want to hear their testimonials. What are they experiencing? How do they feel? What are they noticing? Because everybody wants to know, what am I going to feel from this? What am I going to notice first? How long is it going to take before I feel better? And so with this patch, because we are all different, it works differently and individualized for each person. So what people notice technically first, this is just from our clinical studies, right? They notice a reduction in pain. They notice an increase in energy. They notice an increase in mental clarity and focus and concentration. They notice a deeper sleep, a deep REM sleep. And they notice faster wound healing. And so that's the general population, the general consensus of what people notice first. And we're not here to treat, to diagnose, or to cure anything at all. We're not making any of those claims. But we do have people that suffer from symptoms of things like autoimmune disorders and mental, emotional diseases and disorders. Things, you know, with ADD and Alzheimer's and bipolar and dementia, you know, autoimmune Parkinson's and MS and lupus. And so there are a lot of things that people have symptoms. They have symptoms of fatigue, of you know, bowel digestive issues. They have immune system issues. Their nervous system, they're always in that fight or flight, go, 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 stressed out mode. And so the stem cells can go to work to help and heal and repair those systems in the body so that the body become back to that homeostasis. Now, how long will it take? I don't know. We're all different. I don't know what's going to happen first for you. I can tell you what happened first for me. I can tell you what happened first for my daughter, my son, and my husband, and countless thousands of other people that I've talked to. But the thing is, we're going to put it on, and we're going to leave it on, put it on in the morning, even though I just put this one on right now. It's totally fine. You can take it off and put the backing right back on it. I'll put it on tomorrow morning. But you're going to put it on in the morning. So here's the rule. You leave it on 12 hours. 12 hours on, it's activating your body's own stem cell production. During that time, make sure you're drinking half your body weight in ounces in water. Very important that you're drinking water. Our cells need that conductivity from the water and the light, the phototherapy, right? And so half your body weight in ounces every day. We know as we age, our cells are more and more dehydrated. So we need to compensate that. And then take it off after 12 hours and throw it away. Or if you have a pet, you can put it in your pet bed, or you can put it in the back of their collar. You can put it on their collar, or maybe a place that doesn't have fur where it's going to, you know, stay on them. So it works for pets too. It works for horses. It works for dogs and cats and chickens and cows and pigs. We've seen so much over the last 17 years with what these patches have done for so many animals and people, of course. So we can definitely do that. So 12 hours on to activate, 12 hours off is regenerating, repairing, rejuvenating those cells and tissues and organs. And again, I can share with you, you know, clinical studies what is shown to be effective for the majority of the people and the majority of the people, their time frame, right? We have a great website, and it's startx39.com. And at that website, you'll be able to see all the clinical studies. You'll see the studies from Harvard and from Oxford and from Stanford. You'll see the personal testimonials from people, from doctors, DCs, DOs, MDs. You'll see David speaking on that website. Plus, you'll also see the patents that David holds on there as well, too. And so that's going to be a great resource if you're looking for science and facts, and you're looking for testimonials from people, real people using the patch and what's happened for them. So that's basically, Karin, that's basically the gist of it.
Yeah. And so how long has the X39, the stem cell patch, been out?
This patch has been out 2 years.
Okay.
So it took David 10 years to figure out the correct X39, that's what it's called, 39 tries. It took him 10 years to figure out the right combination of the organic amino acids and salts and water to form that crystal lattice. So it's not like you just take some amino acids out of a jar, here's some table salt, shake it all around in a petri dish, and boom, your body's making stem cells. Yeah. This is, believe it or not, it's very detailed. It's very scientific, and we can share that with you as well too. But just know that this is a signal. It's signaling your body. It's a pathway to signal your body to increase its own stem cell production.
Right. And the incredible thing is that this now suddenly makes stem cell therapy reachable for the general public, because stem cell therapy often costs hundreds of thousands of dollars.
Yes, correct. So myself personally, I have been in the area of stem cell research for the last 20 years. I've banked both my kids' cord blood, and to do that was $2,500. And then there's a storage fee of $125 per year, which we have done for the last, my daughter's almost 19, so 19 years. And we have done literally over $100,000 out of pocket in traditional types of stem cell therapy for my daughter as well too over the last 10 years. So I'm very familiar with different types of stem cell therapy, and it's very expensive. It's very invasive. It's very time consuming, and it's very costly. So this is the price of a cup of coffee that you put on every day and you take off every night. And it's signaling that body during the day, and it's repairing, regenerating at night. But I'll share with you, with my daughter personally, we have seen more progress with her. We've seen more results. We've had more changes than we have literally in this last 6 months than we have in the last 14 years. Of every type of holistic therapy, modality, in and out of the country, every lotion, potion, pill, bottle, everything holistic, we have experienced it. And we haven't seen anything like this ever in all areas of her life have completely changed.
Yeah. And so how long have you been using the patches with her?
We started back in May, so almost 7 months now.
Okay. And what are some of the changes that you've seen in her in the 7 months?
Well, she's been in a wheelchair for the last 14 years from a traumatic brain injury after a misdiagnosis from cancer. And we spent a year in the hospital. And so she's had a lot of complications, a lot of surgeries, and she hasn't been on any medications for the last 12 years. It took me about that, a while to wean her off of that. But we have noticed now that she has more mobility. She's stronger. She's gotten taller. She's gained weight. She has more control of herself. You can ask her to move her hands or her legs, and she will actually do that on command now, where she wouldn't before. Her communication is incredible. Before, she would sometimes answer or She understands everything. She can write with assistance, but now she'll answer every question you ask. You can have a conversation with her and she will answer, and she has some new words as well too. So her communication is greatly improved. Her level of joy is amazing. The child has always been happy, but now she's happy all the time, 24/7 for every single person. She will interact with them. She will answer their questions. She's just a bundle of joy now. And it's fabulous to see and to have her teachers write that on a daily basis. Two of the pretty big things that have happened for her outside of the communication, which is huge. She's had a blood clotting disorder since she was 3, which is what ended ended up being in the hospital for a year, and that has resolved itself. And what I mean by that is if she would hit, a little bump on her chair, or, on the door frame, or, just anything small would turn into a massive, huge bruise, because she didn't have one of her blood clotting factors working correctly. Well, now it works correctly. And so she doesn't have the bruising like she did before. It's completely different. She may get a little baby pinpoint bruise, and that's it. She's good to go. So that's been massive. And then also her hormones have balanced. She started her initial, having a period about 4.5 years ago, and every other month here or there, random. And then they were very long. So her menstrual cycles were 2 weeks, and we almost had to go to the hospital to have blood transfusions. She was completely ghost white, lethargic, almost non-responsive. And I tried everything under the sun, everything to balance her hormones. She's not had a menstrual cycle in 3 years. Okay. With everything holistic, the food, the supplementation, doctors, MDs, NDs, everything. So we've been on the patch now for just over 6 months. She's had 6 completely normal menstrual cycles. Normal start, normal stop, 6 months in a row. So that has been huge. How many women do you know out there that have irregular menstrual cycles, that suffer from cramps, that have the PMFs, they have all of the ups and downs and the ins and outs of hormones?
Yeah.
These have balanced hers out.
Wow, that's amazing. Yeah, that was me before I had my son, and then pregnancy regulated that whole thing, which is so interesting. But yeah, that's the thing. It's so powerful to hear, people's personal experiences, what happens, and how they've seen, the different progress. And so yeah, it's phenomenal to see your daughter come to life, and
Yes.
that little person who's been in there come out.
Yeah.
Yeah, that's amazing. So I am looking forward to seeing this is my second day of wearing my patch here. So already I don't have pain or anything, but I do have, degenerative disc in my lower back, which only bothers me certain times. So I need to see what that's going to do. But I noticed in my skin already on day 2 that the pores are getting smaller. And so that's just day 2. So I am looking forward to aging in reverse, looking younger and younger. And
right.
Just already feel good, but you can always feel better, right?
Well, I'll share this with you. One of David's most recent clinical studies, it's not yet published. It was done last year during the lockdown, and the lab is out in San Diego. And so he had taken all the biomarkers from the participants for this study to determine their biological, like their cellular age, right? What's the age of the heart, the liver, the kidneys, the cells, the vessels, right? And 6 months later, because they were on lockdown, they couldn't get together and do any tests in between like he normally does for clinical studies. 6 months later, they all get together, take the biomarkers again. They had reversed their age by 8 years.
Wow.
Their cellular age. So for me, I'm healthy. I don't have any health issues. I don't have any problems. I don't have any pains. I don't have anything. I've learned a lot with my daughter. I've taken very good care of myself over the years, right? Had a little weight gain issue a while back with a gluten intolerance, years back, and got that under control. But 6 months using this patch every day reverses my cellular age by 8 years. So that means in less than a year, I'm going to be in my 20s.
Right?
Sign me up for that.
How awesome is that?
Right? Improving the quality of life every single day. And that's what this is about. If you have tons of health issues, tons of concerns and symptoms and diagnoses and that, we can help you. We can help you with that. We can help you have a better quality of life. The time's going to go on anyways. Days are going to pass. Weeks are going to pass. This will give you the ability to not only gain back the life that you've suffered, that you've missed out on for different things, right? Lack of sleep, intense pain, not being able to focus or interact with, I get it because I work with those people every day. This will not only give you that back in months to come, this will give you a whole new leash on life that you didn't even remember that you had. Because you will feel, it's not about necessarily what you look like. I mean, it is for me, I'll be honest, but I want to age gracefully on the outside too, right?
Yeah.
But a lot of people are like, I don't care what I look like. I just want to feel good. And I get that. I do, because my husband was a dirt bike racer. And so he's broken everything under the sun and didn't sleep at night, had a mind that would race all the time. Now he does not get up in the middle of the night anymore. He sleeps through the night like a baby, deep REM sleep, and all of his aches and pains are gone. And so I understand living with somebody that is in pain and doesn't sleep well and can't shut their mind off and is stressed all the time. And so this can definitely help you improve the quality of life wherever you are, whatever is going on with you. So I'm excited about that.
Yeah. And that's the thing, is that I work with so many people that, like you said, they have a list of things that are going on with them, and the aches and the pains and whatnot. And when you are in chronic pain, it's really hard to really focus on anything else, because just getting through the day is a chore. So this is phenomenal, and not putting a Band-Aid on, masking what's going on, but actually allowing your body to do the magic that it's designed to do. Mm-hmm. What I'm always looking for, I'm always finding people and sources and whatever we can do to turn that on and keep it going. So this is really phenomenal. Yeah.
Well, I look forward to coming back on again, and maybe we'll have some questions.
Yes.
If you have questions, and I can definitely help and answer. And of course, if you're listening to this now or even the recording later, please get back with Karin and ask her, how can this help you? And we can work together to make sure that we're giving you all the information you need, facts, the research, the data, plus people that have been in your shoes, that have utilized this X39 stem cell activation patch to improve the quality of their lives. So we can share that with you.
Yeah. Time to get your life back so you can go out and live. And that's what this is all about. So thank you so much, Dr. Staci, for coming on, taking the time out of your evening and sharing all this amazing information with us.
Absolutely. I'm blessed to be here.
Thanks.